Hallo, assalamu alaikum. Good morning. Khushamdi ji ayanu. Goedemorgen is Pata.
Pakhair agale, ni hao, chunushumme, washwale, ohaya genzaimus, guten morgen, hola, bonjour, privyet, kaifa hal, hale shuma chatore, ahlan wasahlan, marhaba, buna, mucho, gracias, swabia, bhalli kare aaya, marhaba, and thank you very much, ladies and gentlemen, for tuning into PTV World. You watching World this morning, alongside the very fantastic, the very amazing, the very full of energy, Shahzad Hassan Khan and Shiza Hashmi. Hello, Shiza. How are you doing today?
I'm doing great. Thank you so much for asking. And along with your energies, of course, I think your smile is way too extra today.
Oh, wow.
It's a good thing.
You've already started with it. I thought that,
No, I'm
we're
just
going to
happy
have a
about
conversation
we
and
will.
then get down to
We will
that.
definitely. I'm just really happy about I like to see happy faces. I like to see smiling faces. I feel like it's contagious, isn't it?
It's wonderful. I think you have been babysitting your niece for too long that you actually want somebody to smile other than cry or whine as well.
I swear.
But how's your experience so far, since you've been babysitting your niece as well? So how's been your experience?
Okay, I think I need at least 2 hours to talk about this now, but just saying, I think it's my first time actually doing it all on my own. Otherwise, of course, when I do it, I have help from either her mother herself, my sister, either my mom and whatnot. But this time, I feel like it's fun. She's 5, so she understands things. That's a good thing. So we watch movies together, we go to the park together. But I feel like with kids, they have mashallah, they have so much energy, Shahzad. There's no off button. I mean, being adults and being working adults as well, I feel like there are times in the day when I need a break or something, but there is no break.
Well, but that's wonderful. But I want to get into a little more detail of it because you said that you actually have to do everything by yourself, right?
Yeah.
So what do you mean by that? Because a kid who's actually 5 years old, you really do not have to do a lot of things. Probably just feed them, make sure that they're eating.
Attend to them. That little person actually requires 24 hours of attention.
Exactly.
I swear. I mean, they won't let you sit on your own as well. They won't bother you, but I feel like that age is so beautiful. They actually they're curious first of all. They need to ask about everything, and then they need to share what they feel. And I think it's a very healthy thing to do as well.
And I'm going to share a research with you that, research says that, that a kid who's actually somewhat around 4 years or 5 years old is going to ask you 800 questions daily. So imagine replying to all of those 800 questions. Why did you do that? Okay, why did you do that? Why did you do that? Why did you do that?
And sometimes there's no science to explain and it's so hard. I mean, sometimes you really wish, there in just the 2 days, there were so many times when I told Amal, I was like, Amal, when you grow up, you'll know. And towards the end, she was like, Shahzad, do I have to grow up to know everything? But I mean, it is really that... well, it's a challenge, of course, but I'm not the mom, so I feel like moms sort of have it inbuilt. It's really, they're so loving. I mean, this nature, this maternal nature they have, or mamta that we say, it's a real thing, ladies and gentlemen. The moment you have a child of your own, you really just want to provide them with the entire world.
Exactly. There's only one problem with me, though, since you mentioned about it, so I think I'm going to share it with everybody who's out there as well, and that is that, since we do a morning show, I do a lot of other TV shows as well, and we're on stage, so we have a very different jargon. Now, even when we go back home, sometimes my parents would say that, you're not hosting a show, talk normally. So eventually, what happens is that if I am in conversation with my daughter, and she asks me something, and so I do not have simpler words to make her understand,
I know, right?
And then while I'm sharing it with her as well, and then she's looking at me that, what am I talking? Is it something outside the world? And then I really have to work hard to find the correct words which she will understand so that she can understand the entire scenario. But I think it's beautiful. Towards the end of the day, ladies and gentlemen, whenever you go, you see your kids, you play with them, I think that you carry a bigger smile. And smile, ladies and gentlemen, happens to be the best curve on a human body that I've been saying for a longer period of time. And yes, and there are a lot of people who are very cautious about their smile, and I've seen a lot of people who do not smile because they think that if they smile, their picture won't be good. So they'll probably smile like this, or like this. They really don't want to show their teeth. But today it happens. So not today, tomorrow, ladies and gentlemen, is going to be a very important day.
Yes, absolutely.
And we're going to talk about World Oral Health Day today, ladies and gentlemen, where it's celebrated and observed all over the globe. Because mouth, ladies and gentlemen, is a very important piece Allah has given us. We cannot communicate otherwise. God forbid, if it's smelly, people will offer you gum. And every now and then, if somebody offers me a gum, that's my first question I ask. Do you think, do I smell bad or something? And so I think everybody is very careful because this is how you come across. The very moment you start speaking, you smile, you talk to somebody, this is how you come across and this is how they're going to judge you. So you really need to look after your oral health.
Absolutely, and it's sort of, don't judge me for for saying this as well, but I feel like the first thing that comes across to me in a person
You
is
need a gum? I was just
is
kidding.
the teeth and the smile. Shahzad, it's
Yeah,
national
I'm
TV. I can't
sorry.
believe it. But okay, I feel like the smile actually approaches you before the personality even does, right? Or before the nature of the person even does. So that is why it's so important. And how to have a healthy smile, not just good looking, but a healthy smile is what we need to talk about today. And for that matter, we actually have some huge gums over here.
Huge gums, yeah. Not just gums,
In the
I
studio.
think teeth as well.
Yeah.
Because, gums do not come by themselves only. so yeah, they're
Shahzad is in the
always
mood.
accompanied by teeth. But yes, the teeth
Not
will stay
always.
and the gums will go. That's a different disease we'll be talking about as well. We really need to
Opposite.
spread awareness, share it with all our amazing viewers in 46 different countries. So, ladies and gentlemen, we're very lucky that we've actually been joined by the principal, High-Tech IMS Dental College. He happens to be Dr. Irfan Shah. Hello, sir. Assalamu alaikum. Good morning. And he is a maxillofacial surgeon as well. Assalamu alaikum, sir.
Assalamu alaikum. Thank you,
Welcome, sir.
thank
How
you
are
very
you?
much for inviting us to this show.
Thank you very
It's our
much for
pleasure.
joining us. It's wonderful to have you. And when you actually get to be in conversation with somebody who happens to be a principal, you know that every area is covered. But alongside that, ladies and gentlemen, we're lucky that we've actually been joined by a consultant orthodontist as well. She happens to be Dr. Fatima Salim. Hello, assalamu alaikum. Good morning.
Thank you so much for having us.
Thank you very much for joining us. Wonderful to have you alongside Dr. Fatima Salim. Ladies and gentlemen, we're lucky that we've actually been joined by somebody who happens to be consultant periodontology, Dental College High-Tech, Dr. Syed Shahan Haider. Hello, assalamu alaikum. Good morning.
Walaikum salam. Good morning.
How are you, brother?
I'm good as well. How are you doing?
Good to have you over here.
Same
We're doing
here, same
absolutely fine. And now since you are here, I'm doing better now.
That's good to know.
I'm glad that you guys were able to take our time. Last but not the least, ladies and gentlemen, at a very, Allama Iqbal used to say that, let me remember this one as well, Jawano ko peeron ka ustad kar. And this is a living example because we're very lucky that we've actually been joined by Assistant Professor High-Tech IMS. She happens to be Dr. Amna Riaz. Hello, assalamu alaikum. Good morning.
Assalamu alaikum. Thank you so much for having us over.
It's wonderful to have you all. Thank you very much for joining us. Let's get the conversation started. So first things first, we really want you to highlight the importance of this day and the message this day holds for the rest of the world.
Shahzad, I wish I could speak and I could say hello and good morning in as many languages as you spoke in the beginning of this talk show. The other thing that I would like to mention is that you both have fantastic smiles. When you smile,
I know that's just a compliment for the sake of it because I don't like my smile, but thank you.
no, they are beautiful indeed. Coming to the question, World Oral Health Day is celebrated every year on 20th March around the world, and Pakistan is in the forefront.
Yeah.
The purpose of celebrating this day is to create awareness regarding oral and dental health.
Yeah.
There is a misconception that dentistry is probably related to teeth only. In reality, this entire part of face comes under the domain of dentistry. So, for example, diseases and disorders affecting this part of the mouth could be trauma, dental cavities, gums diseases, and cosmetic procedures like braces and orthodontics treatments. So, unfortunately, awareness regarding diseases and disorders of this part of the body is lacking in developing countries in particular.
Yeah.
Okay.
So, through this day and celebrating this day, we are actually trying to empower people by educating them and by giving them skills of how to maintain good oral hygiene and how to keep their mouths and teeth healthy. Because as we keep saying, mouth is the gateway to our bodies.
Exactly.
And keeping healthy bodies means you must keep your mouth healthy.
Yes.
If you are not keeping it healthy, so the rest of the body could become ill and diseased as well. So we are trying to create awareness regarding the significance of oral hygiene, oral health, and how to maintain oral health.
Brilliant.
That's wonderful as well. And I know, Shiza, that you actually have a question as well, but I think I would rather want each and every one of you to give your messages on this day. So I think that would be great as well. So Dr. Fatma, moving on to you.
World Oral Health Day has a slogan this year. For 3 years, they're going to have this slogan.
Yeah.
Be proud of your mouth.
Yeah.
Okay.
Okay. So when we feel proud when we are clean, well organized.
feel great.
Yeah, we feel great. So the awareness that we create by talking about World Oral Health Day and the early detection it leads to, because the earlier you go to the dentist, it's most of the diseases are preventable.
Yeah.
But in our country, unfortunately, it's not a norm to either take your children to the dentist or go yourself every year. I would like to emphasize that regular or dental health checkups are very necessary. Because they say prevention is better than cure.
Yeah.
So if we can prevent the diseases from happening in the first place, that saves a lot of pain, and it also helps save our economy, because every disease puts a burden
A
on
stitch in
economy.
time saves nine.
Yes,
I think
definitely.
it's a wonderful message. And just when I requested Dr. Fatma to actually share her message on this day, Dr. Shahan started to think about his message as well. So moving on to Dr. Shahan. Yeah, please go on.
I'll take on from where Dr. Fatima
Sure.
left. The main theme for this World Oral Health Day is be proud of your mouth.
Yeah.
Because why not? I mean, you're proud of the rest of you as well. So why not be proud of your mouth? And secondly, look, just imagine the things that you can do with a good, healthy mouth. You can speak, you can shout, you can laugh.
Be confident.
Be confident,
Yes,
most of all.
course.
Yeah.
So I think this awareness needs to be given to the people who are living in the rural areas, who are not exactly right in the mainstream education cities. So I think this day actually proves to be.
I think it's wonderful, but I really want to add to that message as well, that ladies and gentlemen, since Dr. Shahan has actually mentioned that you really need to be proud of your mouth, does not mean that you have to be a big mouth, because we have a lot of people, we come across a lot of people who have big mouths as well, and they really don't care what whatever they are saying. I was about to use another word,
Yeah.
which I thought I was on national TV. But Ms. Amna, Dr. Amna,
Yes.
I have a very simpler question for you. We do not want a message from you, but what I would want to know is that, since my nephew is a dentist as well, alhamdulillah, we have 2-3 dentists in our family. So every now and then he would go, and then, when he would come back from the call, he would like, oh man, I can extract a teeth now, or something. I can extract a tooth now and whatnot. So I was like, what kind of education is that? Because you should be rather the savior of our teeth, rather than extracting tooth out of our mouths as well. So, I was always very confused that, what kind of education is that, where we are teaching our kids to take out the tooth, but not really telling them how to protect that. So can you please elaborate on that as well, that why a lot of doctors focus more on taking it out rather than fixing the problem?
I think it's 4 years. There must be an extensive course on it, not just taking the teeth out.
Yeah, it's not just that. This exactly has to do with the oral health awareness as well, because a lot of times people are not actually aware of the problems going on in their mouths. So if you ignore it for a long time, a point comes where the tooth becomes non-salvageable. So then most of the times, me especially as a restorative dentist, we try to save the tooth, but then there are situations when the tooth has to go, and that's basically mainly because of the ignorance, because we ignore it. If we are taking care of our mouths and we visit the dentist regularly, if we spot the problem early, so it can be treated.
Dr. Amna, what is a restorative dentist?
We basically, the restorative dentist, basically, as it says, restoration,
Yes,
restorative.
yes.
So we restore the function and the aesthetics as well.
Okay.
So basically dealing with the fillings and the root canals.
Got it.
May I add to what Dr. Amna has very
Sure, sir,
beautifully
sure.
said?
Please.
You have raised a very, very significant, very important question. Pulling teeth out and extracting teeth out used to be part of the past.
Exactly.
Now every possible effort is made to conserve teeth.
Yeah.
That includes fillings, that includes root canal, that includes gum treatments. So we try our best to retain the teeth for as long as possible. And in fact, that is one of the basic themes of World Oral Health Day.
Yeah.
That children start with 20 teeth, and towards the end of their life, they must keep at least 20 teeth as well. So that's why we celebrate it on 20th of March.
No, what I'm not,
Yes.
what
That
I'm
makes
unable to
sense.
understand
It's
is that, okay,
interesting.
even if they start with 20 teeth, right?
Yep.
And they will eventually get 32, right? So why not end up with 32? Why end up with 20? Why give them the margin of error for 12 tooth? Yeah.
Towards
Let's
the
not
end
do
of
that.
life in this
Yes,
thing.
yes. Again, very good question. Why should we be, happy with losing 12 teeth at least?
Yeah.
No, 4 of the teeth are wisdom teeth, and they don't play a very useful role during their life.
They
So
often
you could
don't
take them
appear.
out. Yeah.
Yeah.
And it's almost impossible.
So 28.
28. So it's
Yeah.
almost impossible for 100% of
Yeah.
population to retain all their 28 or 32 teeth for the rest of their life.
That's true.
So even if we're going to lose teeth, we must not lose all of them. Otherwise, the mouth becomes very, very unhealthy. It's difficult to chew.
At least let's not lose the front ones, which are visible. I mean, at the back, I'm
Yes.
fine. Yeah.
But we're talking about oral hygiene or oral health for today. Dr. Fatma, if you could please explain what is oral health? When we say that my mouth is healthy, what would that entail?
That would
one.
entail not only your teeth being cavity free, free of plaque. Plaque is that white sticky film that everybody acquires.
Okay.
That has to be brushed off regularly. And then the supporting structures of the teeth, which are the gums and the bone, which is carrying the tooth, the socket, they should all be healthy too, because when we talk about tooth loss in old age, or maybe even early, some people have it young too, that means that whatever started in the mouth has gone down deep enough to the bone, so that the bone starts kind of dissolving. I would use that word for easier understanding. And then the teeth start moving. They become mobile, and eventually they are lost. So a healthy mouth would entail healthy teeth, healthy gums, healthy bone, healthy tongue.
Yes.
Up tongue is really important, because we in our country and all over the world, many substances are used. They are abused actually, which cause oral cancers. So prevention of that is.
So can you tell us about those things which can, God forbid, cause oral cancers?
Ji, it is more of Dr. Irfan's domain.
Okay.
But yeah, naswar, gutka, smoking,
Yes,
and putting chalia, pan. All these things, first they don't start with cancer. We have what they call precancerous lesions. And then it could be a small ulcer, and very benign looking, very innocent looking, and that can develop into cancer, which takes over the whole mouth and jaw. And I've seen horrific cases, but we can prevent that.
Exactly, that's true. And not just that, I think I've seen a lot of people, and with their tongues, what they do is that they give cancer to somebody else's ears. You know, so तेज भी बहुत चलती हैं ज़ुबानें यहाँ पे. So I think we really need to keep that. On a very lighter note, even that it's a very important day, ladies and gentlemen. I'll revert back to Dr. Irfan Shah over here. Now, speaking of, since you happen to be a maxillofacial surgeon, and there are only a very few people who are maxillofacial surgeons over in Pakistan, and people do not have a deeper understanding of who maxillofacial surgeons are. God forbid, if there's trauma, accident, anything, there's something goes wrong and something breaks, we have to come to you, right?
Yep.
But why do you think that people are not really very well aware of this very specialization we have over here in Pakistan? What kind of treatments a maxillofacial doctor or physician will offer?
Yeah, just like I mentioned, awareness is actually lacking about dentistry in general.
Yeah.
And it is through celebrating these days, World Oral Health Day, that we are actually creating awareness.
Exactly.
So we had actually an extensive plan of creating awareness. We were celebrating an entire week, not a single day. We were actually planning going to schools to educate our children. We were actually going to public places, and we were going to make demonstrations. We have actually designed these pamphlets that we are distributing all over the country. We have actually planned to go to different universities and deliver lectures there about not only dentistry, but the rest of the specialties as well. Now, maxillofacial surgery is one specialized part of dentistry that deals with, just like Shahzad you mentioned, injuries of the face, developmental defects like cleft lip and palate, cancers of the mouth, and cosmetic surgical procedures like orthodontic surgical procedures. So yes, I agree with you, awareness is lacking. People don't know much about it, but gradually it's increasing, and we will inshallah create awareness regarding all the aspects.
Okay, just one thing though, now listening to what your kind of work is, I feel like this comes under your domain as well. So just recently some ladies I know were in conversation with how the face is not symmetrical, one part is probably higher than the other, and then someone suggested that a chiropractor can actually fix the face, I don't know, by doing something to the back, and it will be symmetrical. It made no sense to me. So does that come under your domain if someone wants to fix the jaw probably, or have a symmetrical face?
And so just very quickly, Dr. Shan, can you please throw this pair of teeth towards me? Just toss it to me. No,
you have a mic on. It's okay.
Yeah, because my next question is for you.
Okay.
It's perfectly
Yes,
all
go
right.
on.
Yeah, that perfectly comes under my domain. So some part of those asymmetries are actually treated by orthodontists. And together we work to fix all those asymmetries and imbalances of facial bones. So no specialist other than maxillofacial surgeon can do it better than us.
And it is okay to have asymmetry, right?
It's naturally. Not okay. It's not okay. Yeah, a slight amount of asymmetry is very natural. But visibly asymmetric faces don't look good.
Of course.
So there are treatment possibles. Now we can actually split the jaw bones into tens of pieces, and then we can rearrange them according to the desire and according to the aesthetics of. No, it should not be. Modern dentistry need not be painful.
But modern dentistry
We're
needs to
dividing
be
it into
free, and modern
10
dentistry needs
pieces
to
and
come
then
under
rearranging it
primary
might be very-
health care.
yeah.
Yes.
So we do all of it under general anesthesia, and the patient need not to worry about that. We know how to manage pain, and we do manage how.
The game starts when you wake up.
No, we have outstanding medicine for the
We know
post-operative
that,
care
sir.
as well. Yes.
We know that. I was just, I'm here to make sure that everybody is feeling the way I'm feeling too as well. But moving on to Dr. Shahan. So Dr. Shahan, this is one very common problem. I have a lot of people who have that. Even I have it as well. So what happens is that, we have so many different brushing techniques. Every day we go to the gym, so we apply the same power in our mouth as well. And, we kind of start to get rid of our gums, So these areas, eventually the tooth becomes visible as well. And then, you feel hot and cold and whatnot. So what are we doing wrong in those terms as well, where we, kind of just rub our gums off with our toothbrush?
See, for this purpose especially, we need to go a little back towards ages when we were little young kids.
Yeah.
Remember when you were young, your mother would have told you to scrub your teeth,
Yeah.
because obviously you were a child, so you
Imagine
couldn't
I
exactly
didn't even
do
brush
it.
my teeth till the time I was in 5th grade, yeah. They had to slap me to brush my teeth, yeah.
Well, they were right in one
So
way.
what?
I know, right?
Yes.
Yeah.
So what actually happens is, because children are not so adept in moving the toothbrush around the tooth, so usually parents tell them to just scrub it. So that scrubbing technique actually becomes a habit when you grow old. But the scrubbing is actually not the standard protocol. The standard protocol, as if you want me to show, may I?
Yeah, sure,
Yes,
obviously.
please.
The standard protocol is that you have to exactly save your gums from the bristles. So imagine that this is 90 degrees to your teeth, and this is 0 degrees to your teeth. So you keep your brush to about 45 degrees to the angle, so that it just lies above the gums and the teeth. And then you use a little small circular motion to activate the bristles and then sweep down.
Okay.
So this sweeping down and then activating the bristles actually cleans your teeth, instead of the usual scrubbing method that we all do, because
Got
while
it.
we scrub, we actually change the gum texture.
Exactly, and which is why, with these those automated brushes, you see the bristles moving around, not up and down,
Yes,
right? Oh,
yes.
yeah. So you activate the bristles and then you go
Yes.
down or you go up.
So
Wow,
basically,
that's
the
wonderful.
technique is basically 6 sweeps per tooth, and about in 2 minutes you'll be done with your whole mouth.
32 into 6, I think that's probably
a lot
going to
of
take a lot of
maths.
time. But I think, ladies and gentlemen, if you want a good smile, you really need to give that, piece of your body that time as well. Please make sure that you do that.
But moving on to Dr. Amna, and I'm going to present some of the most common issues that people do face, like bleeding gums while brushing your teeth, or even generally for that matter, or sensitivity to something cold or something hot, especially in the sides. Why does that happen and how to get rid of it? Also, please shed some light on how important flossing is.
Okay. So what happens exactly is, since, like Dr. Shahan mentioned, we don't generally brush accurately. So we're actually
Yes, please.
It's all right, take your time, take your time.
So I asked about bleeding gums. Why
yeah,
that?
I know. Okay. So the bleeding gums basically happen because of the accumulation of plaque and calculus.
Okay.
So those deposits on the teeth and on your gums, they're actually disrupting the physical barrier that your gums provide to the tooth and the support that they provide to the tooth.
Okay.
So once there's an imbalance there, so that's your body's way of responding, and there's bleeding in gums as well. So that can be totally avoided if we follow a proper brushing technique.
Right.
And then for that too, we need to visit dentists quite often, like in a follow-up way, in a 6 months or a year's time, so that they can get rid of the calculus and the deposits that are accumulating on your teeth.
Okay, brilliant.
May I add
sure,
to it
sure.
as well?
Yes, please.
Whatever treatment that we are talking about today, and whatever the procedures, those are all professional helps that you seek when things have gone beyond your control.
Yeah.
But how do you stop that? That's all on you.
Yeah.
So it's a two-way relationship. No matter what we say, no matter what we teach, it won't work as long as you become responsible for your own mouth.
We
Exactly.
just don't have the habit of regularly going to a dentist or
a doctor for that.
a doctor for that matter. But Shazad, these were some of the basic questions that we needed to put out of the way in terms of understanding why we need to talk about oral health. Right now we're headed to a short break, but when we come back we have some really important or rather controversial questions about oral health. You have to stay tuned to find out.
Yeah, I think I'll give it away as well, because once you guys will come back, I think you will know that what you were waiting for is out there, and then they will get enough time to think about whether, okay, what should be the answer to this
Yes.
question. So number one, why is it expensive? I think that, okay, not going to the doctor might be a habit, but not going to a dentist primarily is because of the fact that people think that dentists are very expensive.
Yeah.
why is dentistry so expensive? Is it because of the fact that there's a lot of instrument involved, a lot of medication involved, which is very expensive, or it totally depends on the dentist itself? I think that's something which we need to talk about. And then, yes, there's one more thing, and that is that, since I went, while I was a kid, I went to a dentist alongside my sister, and my sister was getting braces.
Yeah.
And then all of a sudden, the doctor goes like, hey, you know what, lie down here for a while. It was like, open your mouth. So I opened my mouth. He was like, he needs braces as well. So are we overselling? Let's talk about that. Good morning.
Good morning.
The ancient city of Taxila is the heart of stonework in Pakistan. This art, which has been preserved and practiced for centuries, can be seen on many major landmarks of the country. Notably, the Pietra Dura work in the Lahore Fort's Sheesh Mahal. These stone products take days to complete and require immense precision and skill from the craftsmen. The final products are perfect for souvenirs, gifts and decoration pieces.
All right, ladies and gentlemen, welcome back. For everybody who just got tuned into PTV World, you're watching World this morning. And today, ladies and gentlemen, we're celebrating World Oral Health Day.
Absolutely, which
Yes.
actually happens to be tomorrow. But of course, awareness is for any day, right? So that is what we are doing today. In the first segment, we did sort of cover up on the basics of, how to keep your mouth
Yeah.
and teeth healthy. Right now, we have
That is
even more
vocab like this.
important questions as well.
Good.
Here's the thing, Shahzad, I think we've often spoken about it, and we wish that, dental care actually did come under primary health care first of all, so that each and every single person, regardless of where they belong to, what background, they would have access to it. And imagine every Pakistani having a beautiful smile. Wow, I'd love that, Pakistan. But it's not possible. Why is it not possible? Why is it not accessible to everyone?
Well, like Shahzad mentioned, dentistry is expensive.
Why?
And in most people, what they know about dentistry and dental health and dental hygiene is
That is
dentistry is expensive.
It is.
Yeah, that's true.
There are a number of reasons why dentistry is
Okay.
expensive, but
Okay.
something much better than that is, a very good news is that if the treatment is expensive, the prevention is very cheap. It's in your
Right.
hands.
It's free.
It needs just a brush and a toothpaste.
Definitely.
And a little bit of floss maybe.
Yeah.
So prevention is much cheaper. Please try to prevent diseases. That is the best thing. But if you have developed dental diseases, the cost comes from the fact that each and every item of dental treatment material is coming from outside Pakistan. So all the materials are imported.
Okay.
Very few, if at all, are manufactured within Pakistan. So bringing them from outside Pakistan is expensive. The second thing is that the dentist spends a lot of time. So a physician might check you in 5 minutes and charge his or her fee. But a dentist has to spend at least 30 minutes, 45 minutes, an hour at least.
Examining
So
you.
our surgical procedure at time extends over 2 or 3, 4 hours.
Okay.
So this time counts as well. Another very, very good news is that while in private clinics dentistry is expensive, there are hospitals and teaching colleges where you could get these treatment for peanuts. So at High Tech Institute of Dental Sciences, we have world-class facilities, we have world-class clinicians. It's
Okay.
nearby Islamabad and Rawalpindi,
Yes.
and we are providing dental treatment for very nominal charges.
Okay.
So I would encourage patients who have affordability problems to visit these hospitals. It's not only high tech. There are many other government sector hospitals
IMDC,
where treatment,
whatever,
yes, where treatment could be provided nearly free of cost or at nominal fees.
Okay.
So while it is expensive, cheaper options are available as well.
That's true. But ladies and gentlemen, I won't recommend that. And there's a reason, because half of the time, you know what, we obviously are going to a dentist when the situation is out of control.
But Shazad, I
Just
feel
because
like
we're on television, but very sorry. We'll come back to this. We actually have to go for a short break. We'll be right back, ladies and gentlemen. Good morning.